introductions for our group here, for our support group. I started this up in November 2016. My name is Deb Angus. I'm an 18-year traumatic brain injury warrior, and as a result of multiple concussions throughout my lifetime. I'm an author of this book here that I wrote and researched over a period of 10 years while I was working at the University of Calgary and recovering from the brain injury. It is available to purchase here at the back table there, or it is also available at the Calgary Public Library. And our co-founder here is Josie, and she's 4 years into her concussion journey, and she's a healthcare provider, and she's my advisor in the background as well. Guest speaker tonight is Simone Fortier, and I'll hand the screen over to her.
So I'm Simone Fortier. I'm the founder and creator of the Fascia Training Institute and also the creator of the 7-step concussion protocol. And that is a treatment for people who have had concussion or people who want to just improve brain function and balance. So I'm actually working with the Boxing Commission in the United States with George Foreman, and the athletes are a little bit hesitant to say concussion. So I'm like, oh, isn't that interesting? So it's more about prevention and brain health. So the word concussion now can be scary to an athlete because they don't want to be diagnosed with one.
Or labeled.
And they're scared that, was I just in shock? Was that the adrenaline? Do I really have a concussion?
Yeah.
And what I'm noticing with a lot of the athletes is that it's actually a cervical concussion. It's not actually a brain concussion, which is something we can talk about. They're two very different things. So let's see if I get this little clicker right. So I've been working with doing the treatment now, teaching around North America and Europe for over 2.5 years. And I'm teaching to athletic therapists, some acupuncturists actually, physios, chiropractors, massage therapists. And the athletic therapists are doing this protocol because they're with the athlete the most and they're getting results immediately. So it changes performance in the brain and headache actually after just one treatment. Super cool. So why am I an expert? So I can go through my whole long list of education. I am a physical therapist, trained in the United States. But I'm an expert because, one, I'm an experiential learner. I've had 6 concussions. I was deaf for 2 years. I lost my memory. I had, like every severe concussion symptom, I had it. I didn't know right from left. Couldn't remember people's names, which is quite a common concussion symptom. But I had tinnitus, but not only did I have tinnitus, of course, I had musical tinnitus. I would hear Amazing Grace at 2 or 3 in the morning. I thought it was coming from my phone, deleted it off my phone, I thought it was the neighbors, I thought it was the radio. And then I talked to some of my medical doctor friends, what is going on? And they're like, you have musical tinnitus. So my brain decided to do music instead of a high-pitched sound.
That's wonderful.
Still drives you crazy.
Oh, I know,
because
but
you're like,
still.
I have a whole, and now, and so it is interesting because for me, it would happen at that time of day, because if I turn on my left side, that's when I get it. So currently now, it will only happen maybe once every couple months. And so now it's not Amazing Grace, it's classical music, which is a little bit easier to do. But if I listen to some classical music and I have something going on in my head, it will actually repeat. So I'm not getting the high pitch, but it can make people just as crazy. So I also had herniated disc, dislocated shoulder with the accident. I was sleeping for 6 months sitting up. And what I learned with all of that, so people with concussion often do not want to lie down. And the reason for that is because their brain is in fight or flight. And if you are in fight or flight, 1, you can't heal, but 2, you don't want to lie down. So sleeping, sitting up was better for me. But now when I'm treating people, I can see if their body is in fight or flight immediately. And then if they're in fight or flight, they could do every modality under the sun, and they won't last. Could be the best people.
Relax.
It won't last.
Oh, last.
So because if your body's in fight or flight, you're running from the bear. You're not healing your arm, you're not healing your back. And then you're still running on the bear and you decide that, wow, I can't run anymore, you're now in freeze. So freeze is a totally different scenario. It's like you're playing dead. So your body's doing that. People become numb, overwhelmed, there's way more anxiety. So there's really interesting different stages there. So I've created this protocol that I teach through experience, and also too, I sought out every practitioner under the sun and going, okay, how does it work? Which leads to working with professional athletes. This actually helped me create it too, because they want to be the best of the best. And we talked a little bit about athletes there, but the most common form of concussion is falling in seniors and children. So athletes are just a small percentage of that, but they get a wide kind of exposure in the media, which helps those that aren't professional athletes. Hi guys.
Sorry, your face. Some ugly weather out
So
there.
do you guys have concussion?
Oh, I actually do, but I'm telling her.
Excellent. So the people here with concussion already pretty much are familiar with the definition. It's a traumatic injury to soft tissue, usually the brain, as a result of a violent blow, shaking, or spinning. So a fall without hitting your head can create a concussion. Whiplash can create concussion. Shaking a baby can create, cause death. It's really, when those things going on a roller coaster ride can create a concussion. Just even the acceleration and deceleration, because you don't actually have to hit anything. And a brain concussion can cause immediate but temporary impairment of the brain functions such as thinking, vision, equilibrium, and consciousness. You don't have to go unconscious to get a concussion, and that's old school thinking, but it's not accurate. So the sudden movement can cause the brain to bounce in the skull, creating chemical changes in the brain, and sometimes stretching and damaging brain cells. Inflammation in the brain, swelling in the brain, and bleeding in the brain. So you really want to get the inflammation out of the body, because it can then become systemic. So people have lymphatic congestion and overall swelling in their whole body. And that's hormonal, as well as the swelling and just the changes in the brain chemistry. And again, a person doesn't have to hit their head. So this is an interesting statistic. 80% get better within the first 4 weeks. 80% of people in general, 20% do not. So why is it that the 20% do not get better? And in my clinical observation in over 15 years, it's because the brain is already chemically altered, which means they either have ADHD, they have obsessive compulsive behaviors, personality disorder, immense stress can change the chemistry in the brain, any sort of trauma, and accumulation of head injury. So they may have had, several as a kid, and then as life goes on, they get more. And so we got to look at 80% can get better really without doing anything. Dark room, the old thing. But where we are now is like, how can we accelerate that so the brain is optimized, so for the next one, they don't get the same symptoms back? Because the 80%, if they get 4, 5, 6, 7, 8 concussions, they're going to be in the 20%. Because, again, the brain's starting to compensate. And how the brain does that for each person is different. Okay, so what I see most people is after 4 weeks, they still have the same symptoms. And I've actually treated people who played in the CFL and are now 65 years old. And they're like, well, can it help me now? And it is helping them. The brain can always change, and memory can improve, balance can improve, pain can dissipate. So all these things are available. It's just really, where do you go to do that? Because it takes a team to heal concussion. Not just one therapy, not just one practitioner or one modality. And it takes a team, so finding the right team for each person is important. And so I took this slide out because I didn't know how long I had to talk, but the Brain Injury Institute takes 2 years to get into, and I've been there twice. And all they do is you have a concussion, you had ADHD, here's a piece of paper, that's their treatment. It's a diagnostic research tool only. So if you're saying they denied me because of my age, it's because you're not within their research program. It's within a certain group. And all they're doing is collecting data to see what symptoms they have. They do not offer treatment.
No.
And it's called the Brain Injury Institute. And people are like, oh my gosh, I'm here and now I've waited 2 years and I still have no answers. Because you know you're concussed. You absolutely know you're concussed. You don't need somebody to tell you that you're concussed. You're like, I'm not myself. I'm so far from myself and my memory's gone. They're like, oh, it's your age. Or, oh, I have pain all over. Well, you're aging. And they're not really looking at, yeah, the concussion is a cause of all these things. So it's a good start, but it doesn't offer treatment. What they do is they refer you to the Chronic Pain Institute, which then again you see a team, they assess you. You have an OT, which helps you with pacing, which is important for a lot of people with ADHD or OCD behaviors, because when you have concussion, you think doing nothing is still 12 activities a day, and the brain can't do it. So you have to learn how to pace, so that is important, but they don't deal really with the concussion itself. So there really is little treatment as a team within the government right now for that. Okay, so it takes a team. We got one member here, an acupuncturist. They are important because you've got the nervous system, you've got the organs, you've got the meridians, all of that needs to be in harmony. Okay, so so this is a model really from the United States, because that's where I do all my concussion training and I teach there, but they work as a team there. So the medical doctor should be the one that says, you need to go to physio, you need to go to acupuncture, and now there's several clinics that have all of this under one roof, so that they can monitor and see what the person's doing. Physical therapists usually here in Canada is the one that should be second in command to say, you need these many treatments of massage, you need this, 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 and that, and that's not happening because in this system it's very segmented. So people are ending up having to find the person themselves, find it online, ask Google, who knows, because I don't know. And when you're concussed, you're not the best person to speak for what you need, because your brain is in distress, you're in survival.
Very hard to advocate in
You
that
cannot, and you know what? They're like, so how are you feeling today? Like, I don't know how I'm feeling.
Yeah.
You know, I'm concussed. I'm going to say fine because everyone says fine,
Yeah.
right? But something's wrong with me. I'm not able to work as much. I'm sleeping. I'm going home every night because I work all day. I do really well at my job. And I go home and I binge watch science fiction till 2 in the morning because my brain needs to relax. That's an ADHD thing. So ADHD needs to self-medicate to calm their brains down, so they need a lot of stimulus. So for males, they usually go to extreme behavior, drinking, drugs. Again, it's all this stimulus trying to calm the brain down. And so for me, I'd watch science fiction till 2, 3 in the morning, then I go to bed. And then I get up at 5. So not good for healing, not good for releasing growth hormone to heal my brain. So the manual therapies, which go into brain therapy, acupuncture, and also the cranial sacral. So cranial sacral is a really good tool, but it's one modality, so it doesn't actually create space in the brain. So with my modality is actually physically moving the sutures to release the pressure on the pituitary gland, which is the master gland, and if it's compressed, which with any sort of trauma compresses the skull. So then your lymphatic vessels, your blood vessels, and all that go through your brain they're compromised. So with cranial sacral, it's trying to push fluid, that there's no space to push fluid. So sometimes the results can be temporary, or it can create a month-long healing because the nerves are irritated because of all that fluid being pushed. The nerves are freaked out. So usually any change creates pain, But good pain and good change is usually up to 4 days. Anything longer than that, there's something that was imbalanced in your body is now traumatized and trying to get over. So nerves do take longer, but it's that much fluid pushing into the nerve's irritated, and that environment stays for however long it stayed. And then the nerve's irritated. So this here, even if it's a good change. So when we do the fascia work and we open up the sutures, all of that's pain-free. But if the person's going to have any symptoms, which most people that I'm finding with this protocol don't, they actually, wow, my memory's better, oh, my vision's better, or oh, like, I feel like myself, and they look like themselves right away because we're creating space. But fascially, if we open up the fascia, there can be some discomfort because the fibers are opening up. So inside the body, so it's not about force, it's about finesse. So the difference is everything with concussion has to be finesse, cannot be forced.
It has to be fast.
Finesse.
Oh,
finesse. Which is, yeah, with more finesse.
Subtle.
Because force creates more trauma. They're already in trauma. They're already in fight or flight. So which, again, takes them further away from healing. Okay? And people don't realize that they're in that state for years. But it creates anxiety, as well as negative self-talk, and also really lethargy, being tired, all those things. And that's a result of your body or your adrenals, which you spoke on last time, being in fatigue. Okay, so going back to this chart is, so a lot of people now, a lot of physical therapists are doing the vestibular adjustment, and that is particularly for headaches. So if there's an imbalance or if one of the bones in your ear is loose, this is an amazing treatment for that. And there's like 4 or 5 physios who do it in town. But there's one person who does it with the helmet, and it tracks your eye movement, and then she can know exactly what adjustment to do. And so it's amazing, but after that she gives you all the same exercises as everyone else, which again, may or may not be, you may not be ready for those. But the vestibular is really important. Prolotherapy and PRP. Prolotherapy is an injection of really saline, B12, and glucosamine. And they're doing that injection in the suboccipitals. So for people who are having long-term headaches with no results, this is an amazing treatment for that. And you probably do it about 3 times. So you do 1 injection, you wait about 6 weeks, you do another one, and then you wait about 6 weeks and you do another. But especially in Alberta, it's really an important one because of the pressure changing all the time, that this really helps to release the suboccipital muscles. And it's lasting, and they can also do the traps. And that really works really well too with a cervical concussion.
That's rare. I always do.
Yeah.
I always have that, yeah.
Yep, so it's really neat. And so for the anxiety piece, psychologist or EMDR. Currently in Alberta, there are no sports psychologists that deal particularly with concussion. I've asked the head of the association, and I said, do you have any sports psychologists? He goes, oh, sure. And I go, well, really to work with concussion? He goes, no. He goes, they're general psychology. But what I found out that is I get all my concussion people who have a lot of anxiety or stuck in a neurological pain loop to go to EMDR. Because the EMDR retrains the brain to get it out of that neurological loop, which is causing the anxiety or the pain. And so for an example with that, I had a girl come in, and she had seen everybody, did every injection, finally saw me, and I'm like, after 2 appointments, I'm like, you really need to see Lynn Lambert for the EMDR. Because her
EMDR?
It reprograms the brain neurologically,
okay.
and it's rapid eye movement,
Oh, yeah.
but it's not that.
Desensitization.
Yeah, it's desensitization. And that's part of my concussion. I cannot do acronyms
Oh, wow.
at all. Because like every profession has different ones, and I do so many different things, I'm like, I have no idea what that means. But I have the book, read the book, and it's actually a really great program, and it takes the body out of fight or flight. So for this lady, she saw the truck driving into her. but her physical injuries no longer matched her pain, but her pain was real. And I said, you know, I'm going away for a couple weeks. I want you to go see this lady for 2 times, and then I'll see you when I get back. And her pain was totally gone, because it took her out of that neurological loop that she was stuck in. Because what happens with that is that the brain and the nervous system is saying that was really giving an inappropriate response to something that shouldn't be painful. So, for example, that was painful. And it shouldn't be painful, but the brain sees it as an assault because it's stuck in that trauma mode. So it took her out of that. We could make headway, and she did extremely well. So it's a really effective program. And through this whole thing, there is a hierarchy to this. The first thing is getting the person out of fight or flight. If they're in that, no matter any of these, won't work. Including cranial sacral, unless they're being treated specifically for fight or flight, which they might not even know to treat that. So acupuncture is extremely important. Vision therapy, this is extremely important as well, because the eyes are the key to healing. And when a person lays down and they close their eyes, or even standing up, I could tell you if they're in fight or flight still today, even if it was like 20 years ago. The eyes are key, and what happens too is we get stuck in a particular mode, trauma, and the eyes don't access all the areas that it should, but the information is coming in and actually traumatizes the brain. So again, eye therapy is really important, and a lot of this can be done with anyone who's trained with the Carrick Institute or Deborah Luke. She's an eye therapy specialist, and she's really super booked. She works a lot with kids who have vision trouble, but now she's working with concussion because the therapies are the same, but it also helps get your brain back faster.
Yeah, we also had Dr. Penny here, and Dr. James Haxton, he's a Carrick trained chiropractor.
Excellent. Yeah, because the Carrick trained people are amazing for concussion, because they get you to do these exercises specifically for your reflexes and for your brain and where it's lacking. So definitely want this contact information.
Okay.
So with the fascia work, we really want to create space in the cranium. So the whole mentality or philosophy of that is when there's no space like this, there's pain. So the fascia, the muscle, the nerves, everything should be moving like this, gliding. And the fascia creates space inside the body and holds everything in suspension. So if it's like glue or stronger than concrete, there's no space for things to move. So there's pain. And same with the cranium. If there's a hit this way, this way, this way, there's less space. And so when we open that up, all the vessels, all the lymphatic work, everything starts to flow. And what I've noticed with concussion people, there's a circulation problem to the brain, which means a lot of the blood and lymphatic fluid can go up, but it doesn't come down. So if they do cardio, exertion, and they get big headaches, or they feel like falling over and all that stuff, is because that fluid can't flow out. And we really need to get that fluid going both directions. And oftentimes there's, C1 issue, but it's mostly fascial restriction there because, again, you lost space. So we need to create that space back in the body. So it helps the pituitary gland, which is the master gland, which controls all your hormones. So in the research, which I actually wanted to do my thesis on, but because this was a long time ago, and it was particularly for women who have been in car accidents, within a year after the car accident, usually within a couple weeks, they start to gain weight. No matter what their exercise level is, no matter what their diet is, they would gain weight. And I'm like, it's because of the compression on the pituitary gland. And so it's a thing for women. And then usually after a year and a half, the weight comes off, if the brain's balanced itself out for some reason, whether it's treatment or whether the fascia just released itself, which is normally that doesn't happen. So this part is really important for all the functioning in the body, your digestive system, everything. So if, again, it's compressed like this, we physically have to move those bones. And it's very painless, but we need to have that space back. So this is really where the pituitary is housed. So you see all this connective tissue, fascia, white matter, and all of this is creating space and cushioning in the brain. But when we have an acceleration, deceleration, there's tears in all these fibers, and then the fascia gets stickier, which means people think of fascia just really in the body, but there's significant amount on the cranium, and it's called aponeurosis, and actually it's covered here to protect the brain, but that also can hold fluid. So then the lymph can be swollen here or on the sides. So we need to get that fluid going. And it takes away a lot of pressure, headaches, and systemic pain. So trauma to the brain may interfere with the normal production and regulation of hormonal processes of the hypothalamus and pituitary gland. And this is going into the adrenal piece. It can cause adrenal fatigue, diabetic symptoms, because your hormones can be all off. So the acupuncture, again, is really good with the organs and stabilizing that whole system, but where it's housed needs, again, more space. So after the 4 weeks and the person still is having symptoms, this is why. Is because there is hormonal deficiencies leading to symptoms of growth problems, fatigue, weight gain, low blood pressure, low libido, loss of muscle mass. And it's interesting because these can turn into kind of like really chronic issues, and then you're like, okay, well, I have anxiety, so I'm going to take anxiety medication because my doctor says I shouldn't. So then you do that, it doesn't really work. And also with depression, because this is a physical injury that's making these systems go out of balance. It's not because you're depleted really originally of those hormones, it's because your body's producing them, but there's no space really for the uptake. So most of the time those medications don't work. And then people get frustrated again because it's like, why is it not working for me? And for an example, because I have the ADHD, and my sports med guy, he's like, you can't do any of the ADHD medication. It will blow your brain apart with concussion. And so there's this GP doctor giving this concussion lady a prescription of marijuana and Ritalin.
Oh my goodness.
Oh my.
And because it's not working, he's upped that 2 times on the Ritalin. And this lady's like 30 years old, right? And wondering why she is now suicidal. But it's because they don't know what they don't know. And they're treating symptoms instead of the cause. And if you chase symptoms, it's going to be detrimental to the person. So it's like, okay, why are your hormones off balance? Why do you have this anxiety? Oh, the concussion, that's one of the major symptoms for that. So we're going to go into some treatment options. This is free on YouTube, but I get all my concussion people. Yes.
I have covered this in some of our other videos on coping strategies. This is my passion.
Yes, it is, because these are miracles.
Yes.
And I'm going to say, for example, I had a test done for parasites, and I was supposed to take all this medication for parasites, and all I did was listen to these for 2 months, every day. And, my office, I listened to them, blah, blah, blah. I listened to them in the car, when I'm on the plane, blah, blah, blah. I got the blood test again just 2 days ago, and I don't have any parasites. And I didn't take the medication. So these frequencies heal. They heal tissue, they heal the brain, and absolutely, if anything, please listen to these. And they're free on YouTube. Or Google Play, or whatever, you can download a playlist. I actually bought a couple because they were really nice classical music. But however you want to do it, seriously, this is really important for healing the brain.
Do you have a copy of that, or a list, or?
Yeah, I can email it to you.
Yeah.
I can post it up on our, I'll post it on our Facebook page for everyone else, but I'll give you a copy back because you're not online.
Yeah, but all of these really help promote healing.
I'm a bit mixed on those because I've had clients and myself that don't respond well with them.
So, okay, so we can't go backwards. So, when that happens, because this is part of my area of expertise, nothing works for everybody. Some things don't work for everybody. So when that happens, I'm going, okay, why is that not? So we look at maybe RIFE frequencies. For people who are super sensitive to these, I just turn it right off so that you can't auditorily hear it, but it's going on underneath. Because the sound can irritate some people. Because those frequencies, some of them are not pleasant. So I have them going at such a slow pace, like very low, and or they need RIFE, and or there's something else interfering with that, which could be a physical thing, right? So we would look at why that's not working for you. Because again, each person is individual and there's a hierarchy of treatment, but generally, 95% of the time, these work and they change your blood results. So that's how I test all of this stuff, is I do the science. I want to know what's this changing in my body, and I do all sorts of blood work for everything that I recommend, and it's changed, and I'm like, wow. And then I get other people to do the same thing, and so then it replicates over time. So, but yeah, some people, just this might not be the right order. But generally, I think, you know, it's really amazing for tissue regeneration even. And like, I'm 90 years old, guys, and I do this frequency stuff, like water and frequencies, it does it, very good. So again, diminishing pain at the root cause. So the concussion, why is a person in pain? Why is there dysfunction? Looking at that, looking at what works and what doesn't. So I've also had people come in and they went for acupuncture for years, and they're like, why am I not better? And I'm like, well, because you're in fight or flight. And for one lady that I worked with, she actually died in an avalanche. And I said, now you're ready after treatment. I go, now you're ready to go back to, for 5 minutes she was dead. And really, that's a big brain injury. And so with her, what I did was something totally different to get rid of her headache, was to work on the fascia over her abdomen. Because when she saw that coming, she stopped breathing, and then it hit her, and she was stuck there in fight or flight. So it wasn't for a fascial release over the abdomen, it was to get her out of fight or flight. So I'm like, now you need to go back to acupuncture. No, I'm not going, that didn't work, I wasted so much money. I'm like, go. She went, and it worked like it should have worked before, but she was in fight or flight, so it didn't work. So she's still going to acupuncture. So again, everything has a hierarchy. So this is what I tell people too, because unfortunately all these therapies are not covered by healthcare. So it's like, do you want to be helped or do you want to be healed? And most people want to be healed, but being healed takes your participation. So active therapy means what people do every day is the most important. So in here, even looking at different balance, because I created this book here for kids who are hypermobile, who are falling all the time. And what I noticed, like all my concussion people, all the exercises in that book help heal the brain. So it's also for brain improvement and balance. And this is another factoid about falling. People who fall, there is an 80% chance that a person will have a lower leg injury after concussion from falling, because the brain is not in balance, and also neither is your vision. So, and also too, this is not statistically proven, but through all my concussion people will keep hitting their head until they get the proper treatment, which is very interesting. So continual concussions.
Do you also check their reflexes, like tonic labyrinth reflex, or some of those ones that can get triggered by both trauma and by the incident as well? Because that can also then be part of why they keep having those issues and triggers vestibularly as well as visually.
Right, so it's like, why are those reflexes off? So again, it's compression. So my whole take is about creating space inside the body, both for the brain, but also for the musculature. So if there's tight fascia anywhere, let's say my lower limb, my lymph will pool there, because it's harder for the lymph to push up through restricted fascia than if it was open. So it affects all body functioning, and with concussion, there's usually systemic swelling. So you look normal, but you're not, and that's a big issue for people, and especially I've done a whole series for people who are related to people with concussions, because the person doesn't understand that no, they really can't do that, because it's not because they don't want to, not because they're lazy, it's just their brain does not allow them to do that. And I have an example for that. I had a gentleman who had ADHD and several concussions, played in the NFL, and his wife just thought he didn't like doing certain things, but he couldn't fill out any form. So for his taxes, for anything, this guy's really wealthy, but he'd always get other people to do it. But he got a call from the bank, and the bank's like, okay, we found money, this is what we do, you just have to come in and fill out the form, and we'll give you the money. So he goes in, he goes, I'll give you 50% if you fill that out for me. Because it's not because he doesn't want to fill out that form, he can't. The neurological loop or connection for that was broken, and he just physically can't. And it's a weird, really weird thing for people who don't have concussion. They don't understand. It's like, when I had mine first, it's like I'm grabbing for all my strategies that made me successful. They're not even there. I'm like, so I'm like stuck in a place where I don't even have, I don't even know how to do that anymore. So I understand from this point of view, but pain is personal, the concussion is personal, and the body responds the same way to stress, whether it's physical, whether it's trauma, whether it's emotional. You still have the same physiological response. So any sort of trauma can create this. And again, we've got to get that person out of fight or flight. Okay, and so this is part two, like being disconnected and not knowing what to do. And again, we don't know what we don't know, and that's why we're having this information session tonight and every month, is because what's out there, what can people do that have concussion? And again, just asking the right questions, and your doctor might not know. And again, they don't know what they don't know, because concussion is new. So how are we looking at time?
That's okay, you go with what you want.
Okay. All right. So identifying the root cause, this just really explains a little bit more about fascia and how it's involved. That the fascia is the fluid foundation of the body. This is my definition that I came up with. It's not in any medical thing. And it wraps around every cell, muscle, bone, organ, and nerve. It creates space in the body so all structures can float in suspension like musical harmony. The structures that join them all together is the fascia. The fascia, the spirit, and the brain work simultaneously at the same time and optimally in harmony. And when they don't work at the same time, there's chaos. Okay. And so this is my analogy, is that most everyone knows about apps, like Twitter, Facebook, LinkedIn. Those are all apps. And what it's housed on is the internet. And so the muscles, the bones, the joints are all apps. The fascia is that internet. It connects them all together so they all can work. They're all housed in the fascia. So I'll just go a little bit more. So this is I got this picture in Croatia. So this one here was taken care of. And because this is limestone, and then this one was not. And again, it's looking at what can you do to support your brain, and I don't know if I have those. So daily self-care. So a lot of the things that are most important is hydration, nutrition for the brain, and daily exercises. And so the exercises aren't exertion, because again, if you create too much circulation and there's no drainage out, it creates pain and headaches. Okay, so the hydration piece is sipping water, not guzzling water. So if you guzzle water, it's like rinsing out all your electrolytes, but it's like that rainstorm out there, everything goes away, and so it's taking out good stuff. So the sipping, your body actually uses it, your brain needs it. The fascia loves water, and if you don't have enough, it takes it from your organs. But without proper hydration, your fascia and your brain actually gets stiffer, which again prevents communication. Okay, And then the nutrition part, anyone who's had a concussion should, in the beginning, at least take the bioflavonoids. It supports the brain. And then I get all my people to do a test, and it's on the internet, and it says what your brain, it actually shows what your brain's deficient in. And then they send me the deficiencies, and I'm like, okay, these are the supplements, which are usually amino acids, which are the building blocks of your body that you need to take to repair your brain so that you can sleep, so that you can perform, so that you're out of pain. Because the brain's in distress, it just needs that additional support. But the bioflavonoids, for sure, fish oils are really essential for the nervous system, and doing that test. It's called the BRAVERMAN test. And it's actually the man's name. So this is essential for taking the body out of fight or flight, is breathing. And it sounds easy, but when you're stuck in fight or flight or trauma, you're not. So you're breathing to survive, but not to thrive. So again, this helps oxygenate your brain, your cells, and your muscles and your fascia. And then stretching is really important. Nutrition and hydration. And I think that's good. Good. So, are there any questions? Or is it a lot of information?
So getting back to that, I like that diagram you had there, it takes a team.
Yeah.
And this is my concept as well too. I want to see
Yes.
that provided by people here in Alberta. And so I want to know right now, like just say Jane Doe walks in, or Joe, and where do they start? Where their family doctor's not that well educated in concussion or knowledgeable about concussion, and they want to start medicating us, and we know better that that's not good for us. What would be our first?
Well, that's how it's starting. It's like with each person going, okay, this person knows this, and I go through the whole thing. It takes a team. These are the people to refer to in Calgary. I do have a list, and each time someone takes my concussion protocol, or I have gone to them for treatment myself, I refer to them, because every referral has to be a real one for me. That I'm like, okay, that person does this, and I also match personalities. So if a concussed person has this personality, then this practitioner is the best one for them. And it may not be this practitioner, because again, that connection affects how someone heals.
And like some of us here are dealing with WCD, so they pretty well
Right.
control where we're sent and all that kind of stuff.
Right.
And not even just LTD and that.
Yeah,
What
and I
about-
was going through car insurance as well too, and they, they organized, so they sent me for physio and then vestibular therapy, best thing that ever happened to me.
Yeah.
But still, I was on my own, and then I found out about the brain injury clinic, and I educated myself about mild traumatic brain injury and what it really was, and fought to get the neuropsych assessment.
Right.
And so that's what I'm saying now. How do people? Where do they know where to start?
Well, it's interesting. One of my last classes, I had a physio who's the head of their whole department for concussion.
Until we can get this kind of system set up for us.
Yeah, but it's interesting. She took the class, and she's the head of the concussion department for,
Where?
this is a major, I'm not going to say the name,
Oh, okay.
because she goes, I don't know anything about how to treat it other than ice, heat, stim, or IMS.
Yeah.
And so she took the class, and she's like, really, oh my gosh, because there are a lot of tools that you can do to help a person. Ice, heat, stim, and IMS doesn't always help for concussion. It helps with soft tissue stuff, but not concussion. So that's coming. It's coming more and more. The more people are aware of it.
Yeah.
And again, it's just word of mouth, but also too saying, connecting. Like I'll have a phone conversation with them. And with the Carrick guy, because Carrick Institute does neurological work, but the Chiropractic Association doesn't want them to do that, so they can't really advertise it.
Yeah.
So when I find really good people, I want to go and I get treated by them, because so far I only have 3 that I refer to, and really only 1 does the work, and she's way far south.
Yeah.
So
Same as Haxton. Yeah.
yeah,
But
Yeah.
this is what I'm telling everybody, this is what Alberta Health will give you, minimal. Then if you want extra, you have to pay for all the chiropractic and massage and all that kind of stuff. This is what we can do on our own.
Right, right.
Yeah,
And so,
but not everybody's built that way.
you know, and I've written insurance companies, and they're not interested.
Yeah.
They're not interested yet.
In the interest of time, is there anyone else who had any other questions?
I have one quick question, actually. So, it seems a lot of your work is geared toward the headache part of the concussions, the ones that tend to last a long time because of the fluid buildup. I'm assuming most of the patients that you see come to you on a laundry list of medications at that point. When you're able to get everything going again and the fluids are going where they're supposed to go, do you find you're able to get a lot of people off the meds?
So I'm going to go back to the headache thing. That's just a good example.
Oh, okay.
But any symptom of concussion
Yeah.
is really works with it. The vision stuff, to balance, to
yeah.
communication in the brain, to, again, systemic pain.
Yeah.
That is not diagnosed. So works really for any concussion symptom. And then again, if it's not my lane, it's the team.
Yeah.
Because again, there's an emotional component to it. There's a nervous system, and again, acupuncture is really great for that. So yeah, so it creates all that. So what was the other part?
So I was just wondering, once you're able, like all the systems all
Oh,
start
the
working the way they're
medication.
supposed to, are people able to get off some of the meds they're on?
So what happens with the fascia? Talking with the doctor is like, okay, now I'm finding the medication is actually making me dizzy, or it's doing this, and I'm doing this work. When the tissues open up, it absorbs more. So over time, you would take less, just even without being off of it. But yeah, a lot of times doctors don't want to take you off of it, because once you're on it, you're kind of stuck. But I've had a lot of people wean themselves off with supervision, because I'm not just going to say, no, you can get off that. It's like, you will be able to bring the dose down for sure,
Yeah.
if you have that compression. Because then all of a sudden your body's like absorbing it, like, oh, it feels weird. And then you go down and dose, and then all of a sudden you're like, well, you can talk to your doctor about, maybe I might not need this. And then see that. Because long term, the medications are just treating symptoms.
Yeah.
And then you lose yourself in that. And most people want to reconnect with themselves again. Yeah.
Depends on what you got put on as well. Some of them are really hard to titrate off.
I'm on like 15.
Yeah. Well, but Effexor as an example is a really hard one to get off.
Which one?
Effexor.
Oh, effective.
It can cause a lot of challenges for people.
But
trying to
there's a
walk.
book I'm reading right now that's actually really cool, and it's called The Fellowship of the River, and it's written by a medical doctor, and he kind of touches on that a little bit, but going into plant medicine, and how his fellowship was 2 years doing, really organizing and running an ayahuasca retreat. But it's all about plant medicine, but he was also put on medication, and really knowing that it wasn't quite entirely right. So if you are asking that question, then it's not entirely right for you. But you don't know what to do next or what solution to do. So that would be really good. And if you have a concussion, you might not read it. Audible is really good. So listening to it, because it took me 5 years to read a book after my concussion. So, and I even did a test after. I was like, woo, it took me 5 years. I could do a test again. I was a straight A student before, and like my brain was totally fried. So I do a lot of Audible, but I can read, but it's different reading. It's like, okay, paragraph at a time, go take a break.
Exactly, yeah.
And then, yeah, so Audible's really good.
Well, thank you, everyone. And thank you, Simone, very much for coming today.
Oh, thank
You
you.
did a wonderful job. Thank you very much for coming. And as a little thank you gift, I'd like to present my book for you.
Awesome.
And so glad that you can come and talk to us. Yeah. And everything that you covered, I want to know more about this group. We got to do some more talking.
Yeah,
And I want to see that set up here in Alberta.
Yes.
Yeah.
Yes, and you're the
Thank
one
you
to do
very
that.
much. Yeah, thank you, everyone.